Well, again, my name is Ian Harper, Dean of the Melbourne Business School, and it's a real pleasure to be able to introduce our three panelists to you this morning. We're delighted that all three of them have agreed to join us for this morning's discussion. Let me first introduce Mr. Paul Perreault, who is the Chief Executive Officer of CSL Limited. Morning, Paul. Paul is with us in the USA. He's in Utah presently. Would like to come back to Australia for a visit, so he tells us we'd love to have him, but for the time being, he's there. CSL is the world's third largest multinational biotech company, and amongst many other things, has an agreement to manufacture 50 million doses of the AstraZeneca COVID-19 vaccine at its facility right here in Parkville. They're neighbours of ours here at the University of Melbourne. On my right is Professor Sharon Lewin. Morning, Sharon.
Good morning.
Sharon is an infectious diseases expert, very well known, certainly here in Melbourne through the pandemic, but obviously more broadly than that. Sharon is the inaugural director of our Peter Doherty Institute for Infection and Immunity, and is also Professor of Medicine here at the University of Melbourne. On my left is Professor Duncan Maskell. Duncan is the Vice-Chancellor of the University of Melbourne, and in his own right, an expert in infectious diseases and microbiology. And apart from being Vice-Chancellor, he's a Professor of Microbiology here at the University. So to all three of you, welcome, and thank you very much for joining us for the discussion.
Thank you.
Paul, let me come firstly to you. Seems like governments have done all the heavy lifting so far when it comes to the economic fallout responding to the pandemic. But from here on, I think many of us, including those who are in government one way or another, looking to the private sector to take up the slack, especially by investing for a post-pandemic future. You think the private sector is ready, Paul, to lead us out of the pandemic? Does it have the confidence to do that? And what might that look like in your view?
Well, thanks, Ian. I feel like we've done a lot of heavy lifting through the pandemic as well, but certainly from an economic perspective, I know governments and being here in the US and the scale that we have here, the amount of money that the US government has thrown into the pandemic and really trying to recover the economies has been a tremendous amount. On average, prior to the pandemic, the average bank account, checking account in the United States was about $400, and now it's $1,600. Also, the savings rate of people within not only the United States, but I've been talking to a number of business leaders across the globe. The savings and the cash that's in the systems right now is the greatest it's been in over 20 years. So the amount of investment that people are looking to make coming out of the pandemic will be significant. So I'm really quite bullish that business around the world, including Australia, will over time really rebuild to be better and stronger coming out of the pandemic. Everybody's looking for a place to invest this money, and clearly even in the private sector, consumer spending probably will increase. People didn't travel. They're still not traveling in some areas, as we know. Borders are still closed in a number of countries. And so that money that was spent in other ways is being, put into the banks. And even talking to the bankers around the globe, those cash reserves, as I mentioned, are just tremendous at the moment. So, in Australia, we're already seeing good signs in the business world. I think that business confidence is starting to bounce back. Jobless rate fell from its pre-pandemic level of 5.1% last month in May. So fewer Australian businesses seem to be reporting that the economic uncertainty is affecting their investment plans. And certainly at CSL, that's the case. We're still investing in the business. So I don't think that people are shy about coming back from the pandemic. It's really about making sure that there's the right level of economic stimulus coming from the businesses by making sure the workforce is in place, making sure that you can grow your business and that the investment opportunities are right for the strategic intent that the businesses are trying to really foster. A globally competitive environment that fosters growth and investment well beyond the pandemic is going to be the imperative for the global economy to come back. We congratulate all the governments and things like what Australia has done recently with the patent box mechanism for Australia. this will bring broad benefits, I think, coming out of the country's biotech bench strength that we have as an ecosystem within Australia. It allows Australia to really become more competitive when it comes to countries like the UK and Switzerland, Singapore, and others that are trying to stimulate this investment. So, not only globally, but clearly in Australia, there are some good moves that I see that seem to make sense from a business perspective to really utilize that carrot as opposed to a stick to incent businesses to invest. And as I said, with the amount of money and cash and capital that's available, you really want to stimulate that. Yeah. The science and having confidence to invest in science in the future will lead us towards really that greater sustainable growth in the future. A crisis does help to breed trailblazers and ingenuity and accelerate the solutions to treat and prevent things like COVID and future pandemics. And we've seen that. It's been really inspirational to see the amount of effort that's gone into this. But we can't forget that. We have to invest in innovation continually. And it has to be a universal cooperation, but it also has to be tailored to fit what's going to happen in this post-COVID world. The economic reasons for investing in science can't be ignored, and that starts with education. It starts with STEM programs. It starts with making sure we have the right skill sets through the educational system to really foster that continued investment. Then it goes to, the incentives that government likes to put out when they talk about innovation, which is clearly important, but it has to be a sustainable strategy. It's great that this heavy lifting, and you see this billions of dollars kind of thrown all together at once. But if you spread that out over time with consistent policies, regardless of which administration is in power, that continues to invest in the science for the future, then you don't have to all of a sudden kickstart things because the innovation will have been continual. And we need to learn how to work through these areas of red tape that we've seemed to be able to remove faster than we thought we could in the past because it was an urgent matter, right? So let's not forget that going forward. We saw that in the H1N1 pandemic in 2008, where countries and governments invested a lot in pandemic preparedness. And then after a couple of years when nothing happened, they quit investing. And then they were surprised when COVID hit that all of those stockpiles and supplies were somehow not available. Well, no kidding, So I think I'm very optimistic. I think there's a lot of very positive things that come out of this pandemic. And, I think that the sustainable growth is still inextricably linked to ending this health crisis as well. So I'm not sure we're out of it tomorrow, but I think over the next 12 months, we'll really start to see the businesses emerge, invest. The vaccine uptake has to continue. We need people vaccinated so that we can get to herd immunity type levels. We have to make sure that the employee base is healthy and strong and non-infectious so that we can continue to get that workforce vibrant. And the industries themselves have to continue to invest in their own pipelines, their capabilities, their strengths, and linking them to the long-term business as opposed to managing the short-term opportunities. So, very, very positive, but some basic business sense also that, we just have to return to in terms of, the way we operated pre-pandemic.
Thanks. That's terrific, Paul, and certainly for some of us involved in pushing on the string of stimulus, it's wonderful to hear that there'll be a bit of pull at the other end coming out if your attitude is widely shared. You mentioned the importance of vaccination, so let's turn to that subject now. Sharon, if I could come to you. We're often told we need to learn to live with this virus. So what does that look like? Do we need to have a new vaccine every year for new strains like the flu vaccine? And does everyone have to be vaccinated? Paul's mentioned the point about having our employees vaccinated. Do we all have to be vaccinated before it's safe to travel again?
Well, living with COVID probably means different things to different people around the world. At the moment, it's very clear we will have to live with COVID. It's not going to go away. So we're not going to see the end of this pandemic. In fact, there's hardly any infectious diseases that we really have eradicated from the world. We are not going to eradicate COVID, no matter how many people we vaccinate. So Australia has had a very unusual experience of essentially zero COVID, other than our second outbreak in Melbourne. We've had these spot outbreaks, essentially zero COVID, and therefore zero risk of any infection. And that is not sustainable. It's just, we're seeing it, we're living it right now, as we've seen more infectious variants and the excellent response, but the chaos this brings every single time. What we have to be learning, what we have to institute globally is for people not to get super sick from COVID. We want to prevent COVID disease. So what we really are looking, I'm very confident we can get disease immunity across the world. There will still be people that will die of COVID, but the numbers will be small. But by vaccinating everyone, you prevent everyone from getting very sick with COVID. And that's really the role of vaccination. Now, at a certain level, we're seeing this right now in the US, cities that are up around 80%, obviously seeing it in Israel and places like that. There's no doubt that if you get the vaccination rates up that level, you will reduce transmission and achieve some level of herd immunity, but you'll still get some infections. And for us in Australia, we've got this real challenge of people loving zero COVID. The government's loving zero COVID, but it absolutely not being sustainable. And so first of all, we need to get the vaccination rates up to around 70 to 80% when we can start talking about protecting people from disease and accepting infection. Along the way, though, people that are vaccinated should have some benefits because they won't get sick and they will reduce their risk of transmission to others by 50% with either Pfizer or AstraZeneca. And I think we, in Australia, have to start giving some benefits to people at an individual level for being vaccinated, such as moving around the country if there's an outbreak, such as travelling, such as stratified quarantine. We have a quarantine system at the moment, one size fits all, which was really crazy because the risk of bringing COVID in here if you're fully vaccinated and coming from Singapore is not comparable to if you're coming from India and unvaccinated. So I hope we will start to move the conversation to some of this low risk, but not zero risk COVID.
Right, okay, so some type of yellow card or something, right? Or immunisation card or?
I think vaccination, there's a few things there on vaccination. First of all, I think we need global approval or recognition of vaccines, which traditionally the WHO do. We're seeing these sort of alarming stories coming from the US, like you can't see Bruce Springsteen if you've got AstraZeneca, which is just ridiculous. So I think, and I understand that it's FDA approved vaccines, but we will have to reach an agreement on this. And I really hope this is something we can get global agreement on. The WHO do approve vaccines and they say what is good and what isn't, what is sufficient. So, some of the killed vaccines coming out of China, they're perfectly fine in certain settings and they have got approval from the WHO. So as countries, I think it would be terrible if every country has its own card system on approval. It's a global agreement. Vaccination, knowing someone's vaccination status is really important because it's for their own personal risk and how they behave should be altered of whether you're vaccinated or not, which is exactly what we're seeing in the US right now.
Yeah, terrific. Thank you. Duncan, understandably, there's been a lot of emphasis on the damage which the COVID-19 pandemic has had on businesses, particularly small businesses here in the city, where we're doing it really tough. So I wanted to ask you about the universities, what's been the impact on the universities? But importantly, given your general expertise, how do we think about handling similar disease outbreaks in ways that are less damaging than what we've been seeing, what Sharon's been referring to?
So to start with the universities, the COVID pandemic has been pretty terribly catastrophic for universities in different ways. I'll start not with the business side of it, but universities are fundamentally communities. And the community aspect of the university has been severely disrupted. We don't get to meet our students in person, putting it bluntly. We don't get to meet colleagues in person. Those interesting collisions that you have with people walking across the park outside or whatever, they don't happen. Having meetings with, I chair a lot of meetings in the universities, you can imagine, and some of them are quite large. Making sure that people have their say on those meetings, those kinds of subtle things is quite difficult. So, that's one area which is very important. The second area to do with community is also, of course, that we have quite a few overseas students in the university. Universities are inherently international organizations, but make no mistake about it. And That goes for our staff collaborating in research. It goes for the fact that we have international students. Of course, we've been very hard hit by not being able to get our offshore international students back into the country because of the border closures. So that materially alters the game as well. I mean, to go to the economic end of it, we have taken a very, very large hit in revenue. And with our Australian government continuing to say that borders will be shut for quite some time yet, we are beginning to see international enrolments falling off a cliff, and that will pipeline through for another 3 or 4 years. So we are going to be severely constrained economically for quite some time. And I think that's a great shame, because if any organizations within a society are going to help to dig us out of the pandemic, post-pandemic, it's going to be places like universities, educating young people, thinking up new ideas, innovating, and eventually commercializing research, et cetera. To Paul's point, universities are going to be very important in this post-pandemic area. So, we've had very little help actually from the federal government. We've had considerable help from the state government, and recently, as an example of how the state government are helping to stimulate the economy, I suppose, in Victoria. We just had investment of $400 million in the budget for the new Australian Institute of Infectious Disease that Sharon and I have been working on. And I think that's the kind of thing that we need to be doing. We need to be thinking big, we need to be thinking about the future, and we need to be putting a lot of resource behind how we really use our fantastic universities to build out of this kind of situation. As to how we deal with the future pandemic, well, 20 odd years ago, I was on the World Economic Forum Global Agenda Council on Pandemics that met in Dubai. And we discussed there many of the things that happened in this pandemic.
Yeah, right.
And I think that one of the main things that we need to do is not, as Paul said, with H1N1 flu, we tend to get excited about a pandemic. In this particular one, we had to do some pretty drastic stuff, but then it starts to wane almost immediately after the thing's over. And we can't do that. We've got to keep our preparation level pretty high, actually, because I think there will be more. There are already more chances for bugs to jump across from non-human animals into human beings. There's more opportunity for those to be spread rapidly with air travel, etc. And I think we do have to maintain a higher state of preparedness in the first place. I do think that the federal government closing the borders early, it was a brave move. It went against WHO advice at the time, and it was the main thing that's kept the virus out of this country.
Yeah.
So, taking decisive early action is very important. But I think we're now, as Sharon was kind of saying, we're now at a point in this whole process. We're at an inflection point, really, where that sort of rather straightforward approach to the virus has to be changed. And we have to now have a clear-cut game plan to come out of the zero COVID mindset in this country, and to understand what level of a disease we're going to be putting up with. As Sharon says, vaccines in general, almost all vaccines don't stop transmission. Most vaccines are designed, first of all, to stop people dying, and second of all, to stop people getting seriously ill. If you stop transmission as well, you're lucky. So, this virus is going to join a whole slew of other viruses and bacteria, which we just live with. All sorts of bugs kill people. There are now many more deaths from flu and pneumonia in the UK, for example, where I come from, at the moment than there are from COVID. So we're going to have to start treating this virus like any other virus in an immunized population.
Yeah. Paul, if I could come back to you, and here's a question I was put up to by my students. You won't be surprised.
Right.
We talk a lot here at the business school about, what corporate social responsibility, ESG, call it what you like, but the need for business to have a strong ethical outlook and foundation to what they do. And yet, of course, we're not teaching people to necessarily ignore, on the contrary, the normal motives for profits making. So CSL is a listed for-profit corporation, and yet CSL has been and will continue to be called on to do lots of things, right? To do lots of things that whatever it can do to assist. Sure. So how do you and your colleagues around the board, presumably, think about trading off, in CSL's case, the profit imperative that the stock market is driving you to, alongside your wider humanitarian obligation, given the sort of work that CSL does?
Well, I guess, Ian, I would say we don't trade it off. You can do both. You don't have to have a trade-off per se. So, we're a values-based organization. I mean, the quickest way for me to help you find a job with another company is don't live the values at CSL, right? So we believe in the values. It's instilled all the way through the organization. And, somebody, I think at the Melbourne Business School actually made an observation to me one day. It says, you do really well as a company, but you also do good. And I think that's really a keen statement, because if you do the right things for the business and for the customers, which in our case are patients and the protection of human health, then the scoreboard kind of takes care of itself, right? So you can do both and they can live in harmony, and you should. I mean, businesses, the push on ESG, I get it, I understand it, but, we should have been doing that all along. It's not something that we should just be ignoring. I mean, we should care about what we're doing, and we should care about our mission and our vision and acting the way we say we're supposed to act. CSL was established over 100 years ago to bring medicines to Australia when the supply lines were cut off from Europe after World War I. And so the government started Commonwealth Serum Laboratories. But today, as a public company, we're taking medicines from Australia and all across the globe. We sell into more than 102 countries around the globe. We have operations in 36 countries. And, this includes things like our biosecurity contracts and partnerships in the US and Australia, in the UK, which ensures influenza pandemic preparedness in these countries as well. And this long-standing human health commitment is what forms the DNA within the companies. And so balancing our responsibilities to community was not really the challenge in CSL. In fact, it's really the imperative that we live by with the values of the company. So, for example, the early days of the pandemic, looking after communities within we operate were top priority, because our employees, the frontline workers, whether it be in Broadmeadows or Parkville or at our facilities in Wuhan, for instance, or in Switzerland, Germany, the UK, and the US, we ensured that the safety and security of our employees were monitored every day, and the health of the 600 people in China when the pandemic first came out was monitored. Our responsibilities extended beyond our employees in China to the broader pandemic efforts, and including donations to the Chinese Red Cross, and in early 2020, our contributions in working with the University of Queensland vaccine in the development program in 2020. We're not seeing anything out of that, right? Because we work for 9 to 10 months to really try to get that vaccine on the market, and things fail. I mean, research is a risky business. And if we're not doing the right things and we're only going to take the shots on goal that we know we can make, then we're never going to innovate, and we're never going to be able to invest in the right things. So, like many businesses, we examined how we could contribute to the global humanitarian efforts. And knowing our strength as a global science-based company and business, we quickly realized that, we were in an excellent position to really help with some of the leading expertise that we had in terms of technologies and facilities to rapidly scale up developments of coronavirus, not only vaccines, but treatments, and offered up governments for governments and scientists around the world some of those technologies. This included retooling our onshore efforts in Australia, our recombinant protein manufacturing facility, to manufacture the 50 million doses of the AZ vaccine for Australians. Our collaboration with industry partners to develop a hyperimmune plasma product was there. And we had 2 antibodies in our portfolio that we ran clinical trials across the globe. Unfortunately, the results were not, positive in terms of treatment. But to Sharon's point, it'd be great if you had herd immunity and nobody got sick again from COVID, but that's not reality. We will be living with the disease, and we will need treatments as well and therapeutics. So, these didn't come to fruition, but we invested anyway because it was the right thing to do. We had the portfolio to do it. And that'll pay off both in terms of our learning and the science, and eventually into profitability when we make the right choices on the things that will be effective. So I think these things can live in harmony. And I know that, you've got, corporate speak of returns and return to shareholders, and that's a key part of our support because our wonderful shareholders support our business and they invest in CSL, so they're expecting also a return. But if you're doing the right things and it's part of your strategy and part of your culture and your strategy is sound, you should be able to put the numbers up on the scoreboard, or else, get rid of me because you got the wrong strategy, actually. So that's the way we approach it.
Yeah, thanks, Paul. While I've got you, are there particular lessons that the company has learned from this experience as it prepares for the next pandemic? Are there things that you could say, that we'll set aside because the next one will be able to profit, well, not profit in a material sense, but benefit from the next time we face a pandemic?
Look, I think it's really the resilience that we had within the organization, the ability to shift and move very quickly. It was hard for the organization. I mean, people were working 24/7. So I think, our ability to reprioritize the projects that we had in flight, and then to put those resources in the right places to address the pandemic without trying to distract the whole organization, was a key learning, that you really had to segregate pieces of the business to focus on things that they weren't focused on before, but you also had to free up that space. And that also meant that there are some projects that probably are delayed now, but that was what we had to do to make this happen. And that was the right thing to do, again, for the response to the pandemic. But I think the resilience of the organization and how do we instill the flexibility that we had within our sites and within our plants. You don't want to build, redundant facilities or duplicative facilities just in case, because that's too expensive and that's not the right business decision to do. But what you want to do is make sure that you understand the capabilities, at the very beginning as to what you have to offer for the response. So I think we learned a lot about our capabilities, but we need to take those learnings down and put that across our network and our fleet of facilities, because as I said, we have manufacturing in Australia, China, Germany, Switzerland, UK, and US. So utilizing that global network, what are the key capabilities in each of those facilities that we could draw upon and segregate to prioritize for a future issue that we have to attack?
Yeah, no, thanks, Paul. Sharon, let's come back to you. And I'd like to ask you a similar question as well about the Doherty Institute, because it wasn't as if you were sitting there waiting for, I presume, COVID-19 to turn up, and yet very quickly, the whole institute. But before I go there, it looks like epidemiologists have sort of taken over from economists on the nightly news. And one of the things that amuses me is that maybe there's a little less spectrum than there is in the case of economists. But, X gets up and says this, and Y gets up and says the different. It's just like the economists. So as an epidemiologist and specialist in this area yourself, what lessons do you draw from how we would manage future pandemics, from the different responses that we're seeing and continue to see even today, right? From the states in respect in particular about lockdowns and ways of treating this, right? Some of your colleagues are saying we don't need to do the lockdown. Other colleagues are saying it's about time they did, and so forth. So is there a standard template, or just expect 1,000 flowers to bloom in this sort of business?
Well, I guess the first thing is how do you define an epidemiologist? Because everyone seems to be an epidemiologist these days.
Welcome to the club. It happens with economists too.
Suddenly, everyone's an epidemiologist. I'll say I'm not an epidemiologist. I'm an infectious disease physician and virologist. And my general rule, when you have divergent opinion in anything I work in science, in my own area, is it's when you've got these really just divergent opinions, it's because we don't know the answer. It's basically speculation and opinion. And I would like to see a lot more rigorous evidence in what we do. Now, in the middle of an emergency, you don't have much choice. You just roll. I mean, people really had no playbook, of course. Sure. And Australia, as Duncan said, did a great job. They made very decisive decisions early. But we're now in this for 20 months, and we have to start using in public health, and my background is more at the laboratory end, but in public health, we have to start really using very evidence-driven decisions. So what we're seeing in Australia in different states about lockdown or not is, for me, not driven by the science. It's driven by a whole lot of other factors around, I mean, they're driven around objective factors, whether it's workforce capability, contact tracing, capacity, bit of political prioritisation. And I think those things are not a science-driven approach. Science-driven approach needs evidence and data and predictability. And I would like to see a lot more evidence in what we're doing. And just give you a great example of something I came across yesterday in the UK. And the UK did not have a good response early on. I think we'll all agree on that. But they're doing some fantastic evidence-driven responses now. So the UK just announced yesterday a 40,000-person randomised study to look at different options for quarantine. So instead of just locking up everyone at home for 7 or 14 days in quarantine, they're randomising people to do that at home for 7 days, no choice, to daily antigen tests and go about your business. If your antigen test is positive in the morning, you stay home. But if it's negative in the morning, you go to work. And they will definitively answer how many infections slip out, which I actually think the daily antigen test makes a lot of sense. Randomised fashion, 40,000 people, definitive answer. We will know, can we use this safer approach? And Australia, we have to start doing a lot more of that in our public health response. We're using a lot of empirical approaches. What we have seen over 20 months is a great increase in capacity, no doubt about that, particularly in Victoria with our test, trace, isolate. But we should be using really objective parameters to make our decision on lockdown or not just this is how we do it in state A or B. I really think that tells me this is not science-driven.
And to the question about the Doherty Institute, so put your hat on as director of the Institute, Paul's talking about the agility that he described within his own organisation to get people working on this. I assume something like that happened in the Doherty, then, the race to crack the code and that type of thing. How did that play out, from your perspective as director? How did you get that to happen?
Well, it's been a very interesting and rewarding experience for me as the director, because the Doherty was set up, for those that don't know much about it, as a joint venture of University of Melbourne and Royal Melbourne Hospital back in 2014, with the idea that we would have an institute based with tremendous expertise in research, education and public health, and that would be prepared for the next pandemic. And there is just no doubt that we were really prepared as an institute, and that's why we were out of the blocks very quickly. So January the 11th, as several other organisations around the world were doing, we were, colleagues at Victorian Infectious Diseases Reference Laboratory in the Doherty were already designing the test to detect COVID. Throughout January, they were sharing that already with laboratories around the country. And by the time our first case appeared on January the 24th, we diagnosed the first case in Melbourne and we grew the virus, which was a tremendous advance. But our scientists knew right through January that no one had the virus, so they knew how important this was. How did they do that? Well, that didn't come from nowhere at all. What that came from is decades of investment in virology, essentially, which we've had the benefit of through our investment in public health labs, but also in our research community. There are two viruses where the workforce has come from, without a doubt, for us in the Doherty is from HIV and from influenza, both areas where we have got a lot of the virologists, immunologists, epidemiologists, clinicians that can do this work. What we've seen with COVID, though, is a flood of people from other disciplines, and that has just been extraordinary. So at the Doherty, we have two public health reference laboratories, one that mainly deals with viruses and one that mainly deals with bacteria. But the group that mainly deal with bacteria, they're called the Microbiology Diagnostic Unit. They're fantastic at genomics, and they've been using genomics or barcoding viruses or bacteria to track. They were largely focused on superbugs and transmission of drug-resistant bacteria. And they quickly just used all their tools for COVID. And they're the group that do the COVID genomic tracking that we've seen has been so beneficial in the outbreak response. But we've also seen that on a very small level within the Institute, with immunologists joining, now hematologists, just all these different disciplines coming together. And that I was, really excited by Paul's comments at the beginning about what science has delivered. Science can't deliver everything. We need fantastic political leadership, behavioural modifications, community engagement. But what science has delivered has been extraordinary and from so many different fields. And we have to leverage that. You cannot bring a workforce, you cannot build a workforce with this deep expertise overnight. It's decades of investment. We've done pretty well on that in Australia. We need to do better, and we need to do much better on that in low and middle income countries who some do have that workforce. It's interesting in South Africa, where which I know very well because of the very large HIV pandemic there, have done really well in HIV. They have a workforce of clinical trialists and virologists and excellent public health clinicians that have had to tackle a very major pandemic of HIV. And that whole ecosystem is what's driving a lot of what's happening in COVID. So in peacetime, yes, we have to be ready for the pandemic, but there's a ton of things for us to work on in peacetime as well.
Ian, can I just say, with what Sharon just said, I think that's a key learning if you think about collaboration, because during the pandemic and the learnings coming out is that public, private, and industry academic partnerships, really, those linkages are going to be critical to advancing good medical innovation. Right. I mean, there's so many smart people that we dealt with at Doherty and other institutes in trying to solve this issue. And we don't have all the answers either. It's really that collaboration. And if you can carry this global cooperation forward, you'll be better prepared for the next pandemic. So we really have to, hold on to that and make sure that these public-private industry and academic collaborations continue, because collaboration is going to be the key.
Yeah, terrific. Thank you, Paul. That brings us to innovation, which is where I wanted to go next, very, very helpfully. And to you, Duncan, on that score, I mean, obviously we've just heard Paul make that point, but you've made similar points in the past. The importance of the education system, universities in particular, research institutes, to the innovation effort, the need for government to be involved in that as well. So can you give us some views of your own about how, in particular, universities, governments, business could collaborate to really drive the innovation thing? I think, Paul, you've said before that in many respects, this opportunity, it's a gift, right, for us to drive innovation, at least in science and biotech and medicine. Duncan, this is really your area.
So I think one of the unfortunate things historically has been when people have tried to focus on one part of that complex ecosystem. At the moment in this country, I'm very supportive of the federal government's push to improve our commercialization rate. But I think if that focuses only on universities pushing things out into the market, that's not going to be particularly successful. I think we need to be focused on the entire complex ecosystem that's required to take a brilliant idea that somebody has one day in the lab and turn it into something which you can sell. I also think that we need to be very clear that impact from universities is not just about commercialization. If we can monetize things and make money out of them, that's fine. I have no problem with that at all. But there's a hell of a lot of stuff that's done in universities that has impact that is not easily monetizable, or maybe shouldn't be. And I think what the Doherty's done in this pandemic is a perfect example of that. The work of the Doherty and other people in the university and other universities has been fantastic in making a massive difference to how we've handled this pandemic. Most of what they've done would not be easily monetizable. And I would argue, even if it were, to go out down the commercialization track for some of it would have been immoral at some level while we're facing a major catastrophe like a pandemic. So there are subtleties there that I think is important. I think the most important thing to remember is that nothing can be translated out of a university if there's nothing to translate.
Yeah.
So, if we put too much effort into the commercialization end of things and let the pure basic ideas-driven research wither, then that won't work either. So we have to protect that basic research base. And again, the Doherty is a good example, not the only example, but a good example of where, as Sharon just said, years of investment in basic science has led to having a situation where the foundations are laid such that a rapid response can be made when a crisis like this comes along. That's incredibly important, long-term investment in that kind of base. But the other thing about the Doherty that's good is that it was set up right from the start to be a place where the basic science could meet the real world in terms of the clinicians. And so putting the scientists and the clinicians in the same place and in the same space, thinking together, has been tremendous. And I think that kind of model can be used in lots of other areas too. I'm very keen on the concept of having people from industry, people from Paul's company, for example, coming into the university on a regular basis. I'm very keen for people from the university to go out into companies and have some time there. Learn that many people working in companies like CSL are absolutely brilliant, just like academics are. Learn the language of the different types of science that is done in these different places. One other thing I could go on about this forever, but I won't, I promise. But one of the other things that I think is not often said, which I'd like to get on the table, is that it's not just about science. In fact, most of the things that are happening to us in Australia through the pandemic is because of our response to the pandemic, which is a social response.
Yep.
And so we need to be making sure that we have, while we're talking about the scientific solutions, we also need to embed them in thinking about the social science around that, which goes from economics right through to politics, to sociology, to all sorts of other things, behavioral science, et cetera, et cetera, et cetera. These things are incredibly important to make sure that we get the settings as accurately set as we possibly can to be as successful as we can through this kind of crisis. And I think that also applies to many, many other areas of our endeavor, not just the pandemic, not just infectious diseases, but many of the things where we can commercialize things. If we can have a healthy dose of non-science thinking coming into that, I think that improves the game considerably.
How does that happen? Are you talking about sort of dialogue?
At least a dialogue, yeah. I mean, in a comprehensive university like this one, you would expect people to be talking to each other, in different ways. The fact is that many universities are not brilliant at that, and so we have to try and help people. Not because people don't want to, just because the people are very busy and the opportunities for doing that maybe don't arise too often.
Yeah.
So we just have to help to nurture those kinds of conversations and to get people excited about things. I also think we need to get a lot of our basic science people, not just science, but basic researchers, to understand that getting involved in the innovation and commercialization part of this is exciting.
Yeah.
It's not a burden. It's not onerous. It's actually really exciting. Yeah. And you can actually get a lot of new ideas from thinking in those terms as well for your basic science, which is a positive feedback loop. And the more we can do that, the better as well.
Yep, terrific.
Ian, can I just hop in for a minute about partnerships and where the investment should be in peacetime, and how being flexible means you have to adjust and to be agile. But there's no doubt that having a deep collaboration and partnership with industry that's already established also has made a big difference in the pandemic. And there's, two fantastic examples of that is Moderna with the National Institutes of Health and Pfizer and BioNTech. And both of those partnerships were already there 3 or 4 years ago, working on things. Moderna was working with the NIH on MERS, which, had 2,500 people infected. No one really cared that much about MERS. I mean, people like me were fascinated in it, but they were building a vaccine for MERS, Middle Eastern Respiratory Syndrome, several years ago. Pfizer, BioNTech were working on an influenza vaccine. But it was because you had those partnerships. January 11th, the sequence comes out on coronavirus, and both of them hit the, rapidly change. Yep. Have already worked together, know and understand each other.
Done.
Yeah, and part of the vision for the AIID, the Australian Institute for Infectious Disease, will be, CSL, of course, are a partner of this initiative, as is the Burnet Institute, University of Melbourne, Doherty, and others in Victoria. But we will have a significant part of the building that's just for commercial space, so that we will have small biotech there that may be working on all sorts of things, but they'll be just upstairs, so that we will already have relationships. And most important one, of course, being CSL. But
co-location.
Building that in peacetime is really needed.
Yeah, no, thanks, Sharon. That's terrific. The challenge for us at the business school and the Faculty of Business and Economics is to follow that model in our own area, some of which will be related to the sort of thing you're talking about. Social.
Well, we've done it with Melbourne Connect, with engineering faculty.
Absolutely. Well, we're next off the rank.
We also have our new headquarters that we're building in the biomedical precinct. Just there, wherever there is. At the moment.
Well, it's just very near where Karen is and where we are, Paul.
Okay.
Please know it's quickly. It's amazing. It's up. It's building.
But we will have a couple of floors as well with labs and some incubator space as well, because we think it's important that we support the biomedical research and the the new startups that are coming, give them that incubator space to work hand in hand with industry as well. So, whether it's academic or whether it's commercial, that incubator space will be an important piece of our new investment as well.
That's great news. Now, time now for us to take some questions from our online audience. I'd like to hand over to my colleague Vivek Chowdhury, who will direct the questions to our panel.
Great, thanks. Ian, as you'd expect, there are lots of great questions, and I don't think we're going to have time to cover them all, obviously. The first one is directed at you, Paul, but probably the rest of the panel would have some views as well, I think. And this is from Mandy Holt. She says, COVID and the most recent Chipageddon has demonstrated that we cannot take global supply chains for granted. Recent government policy has begun to consider the merits of sovereign industrial capability in order to drive both self-reliance as well as lift national prosperity through greater investment by government into innovative Australian technologies and increased onshoring. But Australia is a small market, so we must export for this to be sustainable. Do you see this becoming normalised?
So look, it's a great question. And what I would say is, unfortunately, at some level, everybody wants to help everybody in a pandemic. And I think that that's the intent, as long as they take care of their country first, right? So we've seen that time and time again. Everybody's ready to, rally the troops and get everybody going. And then they're saying, yeah, but wait a minute. Well, we've got a few things we need to take care of here first, and then we'll be over to see you. So I understand the sentiment of saying, okay, if it's on our dirt and in our country, then we can have control over it. But for sustainability, pandemics, we don't know when they're going to occur. We know they will. It could be a year, it could be 20 years. We don't know exactly what it's going to cause. We think it's probably increasing. I'm not an epidemiologist, so I'm the one person that isn't sure an epidemiologist. But I would say that it's likely that with the globalization of people moving around the earth, we will see them more frequently. And so I think it's a matter of really, how do you have a sustainable business that can respond in a pandemic that doesn't interfere with the rest of the business, but also is sustainable? In fact, it needs to be a commercial facility that can also sell offshore for Australia, for instance, because Australia is a smaller market. And to try to build one plant that can solve all of Australia's needs for therapeutics, vaccines, et cetera, and be sustainable just within Australia is going to be very, very difficult. It has to have commercial viability outside of Australia to really support it. It's going to be very, very difficult from an economic perspective for a company, even when you're trying to do good as well as do well, to make sure that that facility is going to be suitable. So I think there's a balance that you have to play, and I think it will equalize over time, because people realize you're going to have to, in a global supply chain situation, try to deal with all these complexities. The other thing is really thinking about stockpiling, certain materials that could be used for a longer period of time, because technology does change, so you don't want to store the wrong things. But we've already seen where, just the scale of manufacturing of different vaccines has caused supply chain issues with some other of the life-saving products that we manufacture, and including also just the basics of things like weight bags for our cell culture flu vaccine. So making sure that we're hitting the Northern Hemisphere flu season this year, we've had to pull a lot of strings to try to get the supplies to manufacture the influenza vaccines. So it's really, there are complexities that we have to deal with across the supply chain, not just for what you're trying to deal with at the moment, but also making sure that the rest of human health isn't affected because you don't have the right setup to go forward. So look, I think governments will continue to look for ways to make sure that certainly their population is protected and taken care of, but it really has to be done with a lot of thought, a lot of care, and a lot of openness in terms of what else that facility can be utilized for besides just onshore activities.
Duncan, either of you want to comment on
I think what we have learnt in the pandemic is we need sovereign capability, not just because people in the end revert back to their own countries, but we have a lot of great discoveries and innovations in Australia that we need to be commercialise and manufacture. And it's talked about a lot, but that system doesn't work so well here. And so I think, it needs to be strengthened, and it's been a reminder that we really do need it in the pandemic.
And I think the sovereign capability is adaptable. So we're not going to just build sovereign capabilities to make an mRNA vaccine. The sovereign capability, if it's in the mRNA space, we'll be able to eventually manufacture any form of mRNA-based drug, including cancer therapies. If the gene therapy route for HIV cure comes through, that sort of thing will also be manufacturable from those kinds of facilities. So I think sovereign capability is a good idea. I think it's visionary of all governments in Australia at the moment to be thinking about it, and they need to get on with it.
Yeah. Well, as Paul pointed out, that was the basis for CSL back in the first pandemic, sovereign capability.
But I think the manufacturing capability across the world needs to be increased.
Yeah.
If we take the sovereign bit out of the equation, imagine there were no national boundaries, we'd still be struggling to make enough doses to vaccinate the world quickly enough.
Sure.
So, manufacturing capability across the world could be increased.
Yeah, and I would say regional capability is also very important because, a lot of the pandemic vaccine work that CSL does actually is relevant to the whole region.
Yes.
And if you look across our region, there are, high needs, very significant population and limited manufacturing capability, certainly in the Indo-Pacific area.
Exactly. Vivek.
Great. Second question is directed at you, Sharon, which is really asking if you could follow on the second part of Ian's first question to you about getting vaccine boosters annually or with certain frequency. Will we have to get a fresh jab every now and then?
Yeah, we don't know the answer to that at the moment. It seems that people that have been vaccinated with either an mRNA vaccine or AstraZeneca do maintain antibody levels. They may drop a little bit, but they are maintained. Whether they will drop more over a longer period of follow-up remains unknown. Whether we will need variant-specific vaccines remains unknown, or just a boost for our general antibody level. I think what's exciting that's coming out now is mixing vaccines gives you actually an even better immune response. So we haven't started doing that yet in Australia. Some countries are doing it, Canada, Germany, France. And the data that's just emerging looks like we get even better immune responses. So it's not a given that we will have to have yearly boosters. If we do need to do that, we can cope with it. We do it every year with flu.
Yeah, sure.
Great. So this question is, again, I think relevant for the entire panel, but maybe perhaps start with you, Duncan. What do you think are reasonable timescales to start opening up? People are feeling perhaps a bit too safe in Fortress Australia. Do we need to shift that mindset? And are there any thoughts on how that mindset is going to shift about broader issues?
So I have to be careful here because I have some fairly extreme views about it.
Yes,
that's why they're asking.
I think that certainly once we're vaccinated, we should be open. Simple as that. And we don't need quarantine and travellers or anything, right? Is my view. Again, there are many who would disagree with that, but that's what I think we need to get to. I think that we have, because we've got to zero, right? It's really hard to get back from zero to anything else. Zero is different from any other number. We have to remember that.
Yes, it is.
And I do not envy any of our political people who are going to have to work out what the narrative is that says we can now not be at zero. And if we're not at zero, even though we're all vaccinated, there will be a few people who get seriously ill and die. Okay, who's going to be the politician that's going to stick their head above the parapet and do that? But somebody's got to do it. This is where the next level of leadership in this process is going to have to come from. And we need to build a proper plan to come out of this particular current situation. Otherwise, we are going to be isolated forever. And people like me who've got family at home are going to have to leave and go back there, which I really don't want to do. But it's going to be, it would change the game considerably if we stayed in this mode for too long.
So I know, Paul, you have some views on this as well, which are perhaps as strong. But do you have a sense of how we shift the mindset of Fortress Australia?
Well, let me back in. I'll try to help. Look,
That's why the fortress is there.
yeah, I know. But you said you didn't know me, but you obviously know me.
Good old USA.
Well, look, I think it's really, as Duncan said, it's going to take courage, and it's going to take the right mindset to work with people like Sharon and the experts that say, hey, we're going to have to learn to live with this, and we need to make sure that we have the setup in the hospitals, and when people do get sick, and the right therapy is appropriately ready, and because we will have to live with this going forward. You're never going to stay at zero when you open the borders, even if you've got people vaccinated all over the place. So I just think it's one of those things where you have to pick your timing. You got to pick your timing. I get that, but time's a wasting. And I'd say it's time to, really have a close look at how quickly you get there. And there needs to be a good plan, and people need to be aligned. And you need to have one voice. You can't have, it's like here in the US, for crying out loud. Everybody's got a different opinion. And, it's just, you get a barrage of stuff every night. You got to turn it off, because you just can't process it. So one voice is important. I think, you are a country of Australia that, we talked about the scale and the size, but you have an opportunity, because you've done a great job at keeping it low, but you have a great job to really show how you can open up together as well. And I think that's the important part. One voice is important.
Yeah, I think leadership is going to be absolutely key here, preferably bipartisan support when you're making tricky decisions. And we saw fabulous unity in 2020 in our response early. So states and federal government have to be aligned. And I think we can already start the process. I don't think we should be waiting to 70, 80% immunity vaccinated. Right now we change. There is a lot we could do along the way, and we should already start be giving some benefits, some mobility to vaccinated people. It makes absolute sense scientifically. And so I think we can start the process now.
I think the 2-week quarantine situation, it's what, 13th or 14th century technology. Yeah. We've got fantastic test and trace technology here. There are ways that you could have people traveling right now completely safely without having to quarantine, in fact. And in fact, Tony Blakely and Nathan Grills, two of our epidemiologists and mathematical modelers in the university, did some work recently that suggests that we can open the border to Chinese students now, for example, with no quarantine, and the risk would be approximately zero.
I think we probably do need some monitoring in that place. But hotel quarantine is crazy, because over the last, not crazy, but over the last, everyone in hotel quarantine does not make sense, because over the last months in Australia, in Melbourne, we have had thousands of people in home quarantine. It's worked just fine.
Exactly.
It's been a terrific conversation, as you would expect, with three people of this eminence in this particular subject area. So on your behalf, can I thank each of our panelists, Paul, particularly given the time difference with the US and your other onerous responsibilities. Thank you very much for joining us. Sharon, to you too, and to Duncan, thank you very much. I realise how much we've imposed on your time this morning, but it's been wonderful to be able to hear three experts in the area discuss all these issues. Thank you very much for joining us online.
Appreciate it. Thanks to the university as well for sponsoring this, and my friend Vivek, who helped me, think about this as an opportunity for all of us as well. So thank you very much.
Well done. Thank you, Paul, for just tipping me there. Right, I was going to also acknowledge Vivek Chowdhury, my colleague here at the Business School, whose initiative it was to reach out to Paul, and then to our colleagues here who've responded as well. Thank you for joining us online, and do keep an eye on the Melbourne Business School's website, www.mbs.edu, for other events of this type if you're interested. Thank you, and enjoy your day.